Welcome to our hands-only CPR class presented by Howard County Department of Fire and Rescue Services. This course is going to cover how to perform compression-only CPR, and that is how we're going to treat adult victims. During this course, an adult is referring to anyone who is 8 years old and up. As a reminder, this is a non-certification course. If you do need a certification, I suggest that you try the Red Cross or American Heart Association website. Both have a feature on there where you can input your address and it will give you a list of classes nearest you. In addition to this hands-only CPR class, we do have an extended version called our Adult Child Infant CPR, and that covers everything included in this presentation, as well as covering children and infant CPR and choking relief for all age groups. We do offer a Stop the Bleed course as well. That's going to identify life-threatening bleeding and cover 3 techniques you can use to control it. Those techniques are direct pressure, packing the wounds, and utilizing a tourniquet. We also partner with the Howard County Health Department to offer Narcan or naloxone use training. At this time, the health department is currently running all of those classes. They offer it 2 to 3 times a month, so you can just head over to their website. You'll find a list of dates and a link to register. We also have a variety of fire safety and education classes, including smoke alarm and carbon monoxide alarm education. And finally, our Safe Kids program. The main portion of that is our car seat checks. So you can set up an appointment with our Safe Kids coordinator, and during that appointment, you will learn how to properly install the car seat into your vehicle, as well as making sure the infant is properly restrained in the seat itself. If you have any questions or interest in any of these programs, our contact information will be on the last slide, so feel free to reach out to us at any time. Here we have some goals for our class today. First, we are going to learn what sudden cardiac arrest is and how to identify it. Then we will learn our steps to actually performing compression-only CPR. And we'll end with a discussion on AEDs, or automated external defibrillators. CPR stands for cardiopulmonary resuscitation. So cardio is referring to the heart, and pulmonary is referring to the lungs. What is sudden cardiac arrest? So this is when your heart suddenly stops pumping blood. Before that happens, there are no warning signs. So the person is just going to collapse all of a sudden, they'll be unresponsive, they'll stop breathing, and they will not have a pulse. Now, out of those 3 criteria, you are going to check for 2, and that's going to be consciousness and breathing. You no longer have to check for a pulse. There were a lot of studies done by the American Heart Association that found it's very easy for people to mistake their own pulse in their fingertips for that of the individual. And when that happens, it could prevent someone from beginning CPR when it is necessary. It is important to be able to differentiate between a heart attack and sudden cardiac arrest. Many times people do get these 2 things confused. So with a heart attack, an area of the heart muscle has lost blood flow due to a blockage. In order for the heart muscle to continue working, it needs to have a continuous supply of blood. And that blood is bringing the oxygen and nutrients to the muscle that's required to do its job. So if there is a blockage that occurs, that means a portion of the heart muscle is no longer receiving that blood supply, and that means that part of the muscle is going to die. So with a heart attack, part of the heart is not working, but the other parts are. So the biggest difference between heart attack and cardiac arrest is somebody who is experiencing a heart attack most of the time is still going to be conscious. So they're going to be able to talk to you and describe what they're feeling. They will still be breathing. And if we were checking, you would find a pulse. The big rule of thumb with CPR is if the person can speak to you, it means their heart is working, so you do not need to start compressions. Some common signs of a heart attack can include chest pain or chest pressure. It could also be pain that moves down an arm. And for women, it may show as abdominal or back pain. If you suspect someone is having a heart attack, it is a medical emergency. So you want to call 911 as soon as possible. And then it is important for you to stay and continue to monitor that individual. So try to have them sit or lie down, and just continue, monitoring them. At any point, it could switch. So it was a heart attack. Now something changes. They've gone unconscious. They stop breathing. When that happens, they are now in cardiac arrest. And at that point, you would need to start your CPR. One sign of cardiac arrest that we have discussed so far is that the person stops breathing. Well, there is something called agonal breathing that can occur that may make it a little bit tricky to determine if somebody actually has stopped breathing. So when you take a breath every day, you don't have to actively think about each breath. Part of your brain is keeping that mechanism going for you. So when somebody has gone into cardiac arrest and their heart stops, for a period of time, their brain is still telling their lungs to breathe. Their lungs are unable to do that. And that's because the muscles that control breathing are not getting blood supply. So the heart's not propelling, not forward. So what ends up happening is the lungs are gasping, trying to bring air into the body. It's just unsuccessful. And that gasping can create a really strange sound. It is described as gurgling, grunting, or snoring. The main thing here is if we hear that sound, we can automatically say that person is not breathing. We don't want to mistake it for breathing. They are not moving adequate air in and out of their body. Sudden cardiac arrest can happen to anyone, anytime, anywhere. So it does not matter how physically fit you are, what your age is, what your nutrition is like. Cardiac arrest can and does happen to any age group. About 400,000 people in the United States will die this year from suffering a cardiac arrest outside of a hospital setting. So we hope that the more people in our community that know CPR and are confident enough in their skills to use it when it's necessary, that we'll start to see this number decline because more people will be surviving. The next few slides, we are going to discuss some barriers to performing CPR. These are reasons that people may be hesitant to jump in and begin CPR when it is needed. So the first one we are going to discuss is the possibility of catching a disease. And this comes from providing rescue breaths or mouth to mouth. Now, several years ago, it was taught that regardless of age, everyone who has gone into sudden cardiac arrest should receive compressions and rescue breaths. That has since changed. So now for our adult victims, remember this is ages 8 and up, there are no more rescue breaths. There are a few reasons for that. Number one, the American Heart Association found that when people knew they had to deliver rescue breaths, especially on a stranger, it was really off-putting, it was gross, people didn't want to do it. So that really prevented individuals from getting involved at all. In addition, you have anywhere from 8 to 10 minutes of oxygen in your bloodstream already. That means that if I were to collapse right now, I have the oxygen in my blood. However, it's not getting delivered because my heart is not circulating my blood. Once somebody comes up and starts compressions, they are essentially taking over the job of my heart and they are propelling my blood forward. And now the oxygen that I already have inside is going to start to get delivered. And finally, the very act of doing a chest compression does move some air in and out of the body. It is not adequate oxygen, but anything is better than nothing. When it comes to ages 7 and under, we do still provide rescue breaths. The main reason for that is because often when that age group has gone into sudden cardiac arrest, it was because of a respiratory problem. So for whatever reason, they could not get oxygen into their body, and that lack of oxygen is what caused their heart to stop. So because of that, we want to get oxygen back into their bodies as quickly as possible, and we do that by providing the rescue breaths. Our next barrier is the possibility of hurting someone, and that comes from breaking a rib during compressions. Now, this can and does happen. You may even hear a crack or feel the bone break. We just want to try to push that out of our mind and continue doing our compressions. The most life-threatening issue at that point we need to concern ourselves with is that the person's heart has stopped. So you are essentially becoming that person's heart. You're taking over that job, and you're not going to stop that just because a bone has been broken. People break bones every single day. Oftentimes that is not a life-threatening issue. Doctors can pretty easily fix a broken rib. They cannot fix the damage that occurs from oxygen deprivation. So we want to continue circulating their blood and not concern ourselves with the broken bone. And finally, the last barrier we will discuss is the possibility of getting sued. So every state has a Good Samaritan law. They do vary a little bit. This presentation is going to focus on Maryland's. And this law states if you are an individual who is not licensed or certified to provide medical care in Maryland, that means you're not a nurse, a paramedic, doctor, EMT, anything like that, then you are not civilly liable for any act or omission in providing medical aid to the victim at a scene of an emergency, as long as you follow these 3 criteria, and they are really simple. Number 1, the aid that you do provide is done in a reasonably prudent manner. That just means you're doing it to the best of your ability with good intentions. Number 2, you do not expect any kind of fee or other type of compensation for the aid you're providing. And finally, number 3, that once a trained individual arrives on scene, you allow them to take over care of the victim. Now, with that last point, it is important for you to continue providing care until EMS staff are physically next to you and ready to take over. For example, if you are performing CPR, you don't want to stop when you see or hear the ambulance. You want to go ahead and continue those compressions until paramedics are physically next to you, at which point they'll go ahead and instruct you. You can step back and they're going to take over. Oftentimes when people hear or see the ambulance, it brings a sense of relief for them because the medical trained personnel are nearby. However, with CPR especially, those seconds count. So we don't want to have a long period of time where compressions are not occurring. Now, this law is going to provide you protection in any situation where you are providing medical aid, not just CPR. That does include overdoses where drugs may be present. So you cannot be processed for possessing or using any kind of illegal substance, drug paraphernalia, or providing alcohol to a minor. So it's always going to be best to call for help. If you witness an overdose, call 911. Our next topic is the bystander effect. This kind of switches gears into psychology a little bit. So if we look at this picture, we can see there's a gentleman down in the middle. He's appearing to need help. There's a bunch of people standing around him, just kind of staring at him, and no one's actually providing any care to him. The bystander effect states that an individual will feel less inclined to act because of the presence of others in a group. So we all start to think, well, I don't have to, somebody else will. There's a variety of different ways that thinking can kind of come across. So maybe you're running late to a meeting, you see this gentleman and the group of people, you figure somebody else is going to handle it. There's already a ton of people there. I don't need to stop. I need to get to where I'm going. Maybe you're not very confident in your CPR skills anymore. Maybe you were trained, years ago. You figure there's so many other people around. Somebody else was probably better trained, and they're going to step up and handle the situation. Whatever the reason is, no one is helping the person in need, even though there's a ton of people around. And that is known as diffusion of responsibility. One other reason that contributes to this bystander effect is our human nature. We tend to do what others are doing around us. So if nobody in the group is helping, we tend to just follow that same pathway and not help. However, we can use that to our advantage. Once one person steps up and starts providing care, it's often like chain reaction or the domino effect. Others are more likely to join in, but somebody has to first start that reaction. Even if people are not coming up to you and asking how they can help, don't be afraid to ask your bystanders for help. You can ask somebody to call 911 or have them go find the AED. Maybe you're becoming really fatigued. You've been doing compressions for several minutes. You really need a break. Ask somebody to come up and take over. Even if they don't know CPR, you can quickly show them how to do a compression, and they should be able to take over from you so that you can at least get a break and recover, and you could switch back in. Whenever you are going to ask somebody else to do something, it is important that you use a closed loop communication. And that means you're going to point to somebody specific, give them a task. For example, let's say you ask them to go retrieve the AED. You then want to make sure that they respond back to you in some way. So maybe they will verbally say yes, or they'll nod their head, just some type of reaction or response that okay, yes, they heard me and they are going to go complete that task that I asked. Here we have a list of very general causes of cardiac arrest. Could be a medical problem. Maybe it's related to genetics. There are certain genetic disorders that can contribute to cardiac arrest occurring. Choking does eventually lead to cardiac arrest. So with choking, the individual is unable to bring air and oxygen into their body. Without the oxygen, the heart cannot continue working. So in our other class, our extended adult child infant CPR class, we do cover choking relief. And that is because you may have to perform CPR if the choking individual were to fall unconscious at any point. Sometimes the cause is unknown. The heart stops and we really can't figure out why it happened. And finally, we have our traumatic injuries. And there are multiple types of injuries that could cause cardiac arrest. In this presentation, we are going to focus on a specific one known as commotio cordis. With this injury, we have a blunt object striking the center of the chest during the exact millisecond of a heartbeat. And when that happens, the pressure inside the chest cavity rises very quickly. That rise in pressure is just too much for the heart to handle, causing cardiac arrest. One of the most important actions you can take when somebody's gone into cardiac arrest from this specific injury is utilizing an AED within the first 2 minutes. When that happens, there is a very high likelihood of survival. This is also the reason we are starting to see more requirements for chest protection in sports. It is to prevent this type of injury from happening. Here we meet Louis Lacampora. He was a 14-year-old lacrosse goalie. He's playing a game back in March of 2000. During that game, he was struck in the chest by the lacrosse ball and collapsed on the field, going unresponsive. Now, back in the early 2000s, there really was not a lot of awareness or education in the community for sudden cardiac arrest, CPR, or AED use in general. So when Louis collapsed, everyone thought he had the wind knocked out of him. Let's give him a few minutes to catch his breath, he'll come back around, it's going to be okay. Unfortunately, that was not the case. Lewis had gone into sudden cardiac arrest when the ball hit his chest. This is an example of commotio cordis. By the time people realized exactly how serious the situation was, too much time had elapsed and Lewis did end up passing away. Now, his family created the Akampora Foundation, and that is based out of New York State where they live. That foundation was really crucial in beginning to bring education and awareness into the community about cardiac arrest, CPR, and AED use. In addition, they also began supplying AED machines to schools. So now it's been like this for several years, but now all schools are required to have at least 2 AEDs. Back in the early 2000s, that was not the case. Oftentimes, a school did not even have one. Now, 5 years later, so 2005, we meet Kaitlin Forbes. She had gone into cardiac arrest while playing softball in her gym class. Now, thankfully, her gym teacher, who is in this picture wearing the orange tracksuit pants, he was able to recognize what was happening to Kaitlin. He began performing CPR. The school nurse, who is standing next to him in this picture, came in with the AED, and they were able to work together to save Kaitlin's life. Now, doctors believe that the cause of her cardiac arrest was due to a viral infection that attacked her heart. She did have to have a pacemaker implanted, but she did survive and is alive and well today. Now, she connects back to the Akampora Foundation because the AED that was used on her had been given to the school by that foundation. So it's kind of nice to see this full circle moment. Something really tragic happened with the Akampora family. They lost their son. But because of that, this foundation was created in his memory. And that foundation has saved a lot of lives. There are a lot of success stories just like this up on their website. Jay Bouwmeester, this happened back in February of 2020, so not too long ago. He was a defenseman for the St. Louis Blues. He had just finished a pretty long shift on ice, returned to the bench where he fell unconscious and unresponsive. Now, with it being a professional athletic event, they did have really good medical staff on hand nearby. That staff did use hands-only CPR as well as an AED on Jay. He did survive. Doctors are not sure why he went into sudden cardiac arrest. They really can't figure out an explanation. He did have a pacemaker implanted and did survive. Now, this is a good story of somebody who, he's a professional athlete, so he had to take care of his body. He exercised. He had to eat right. He was only 36 years old, and yet cardiac arrest still happened to him. Here's our last story we are going to talk about tonight. This is Breanna Sudano, and she has impacted Maryland law. So Breanna was a field hockey player for Perry Hall. This day they were out at Catonsville High School for a game. In the middle of that game, Breanna collapsed on the field going unresponsive. Now, thankfully, her 2 coaches recognized what was happening and began CPR. One of the coaches did have to send somebody up to the school to find the AED and come back. So there was kind of a delay in the AED being available to her. There also happened to be several nurses in the audience. So those 3 came down, and between the 5 women, they were able to successfully perform CPR for 7 minutes until EMS could arrive on scene. Now, there's 2 important aspects of her story that I like to discuss. So number 1 was that delay in the AED machine being readily accessible and available to Breanna. If you're familiar with school campuses, you'll know that oftentimes the fields are quite a distance away from the school building itself, and that was the case here. So it just took quite a bit of time for the AED to actually be brought down to the fields in order to be used. Because of this, all high schools now have a third AED and that machine should be traveling to the fields during games. That way, if something similar like this were to happen, it's easily accessible, it's right there on the fields, very easy to grab. The other delay was actually the arrival of the ambulance. So when somebody called 911, they said, "We have a medical emergency here at Catonsville High School." Well, the first place that the ambulance is going to go is the front door of that school. The problem with that in this case, that's not where the emergency was, right? It wasn't even in the building, it's down on the fields. Eventually, EMS staff were able to locate Breanna. They got down to the fields to take care of her. But just keep that in mind anytime you are calling 911. Oftentimes, people really know to give us an address, but if that address is a larger facility, we're going to need more specific information. So letting us know, what floor you're on, what classroom you're in, maybe that you're not inside at all, you're actually outside, maybe you're behind the building or you're down on the fields like Breanna. Whatever the case is, the more specific you can be, the faster we can locate you. Now, the cause of Breanna's cardiac arrest was a birth defect. She was born with a congenital birth defect. So she did have surgery to repair that. After recovering, she went to the Maryland General Assembly and said that we need more training and awareness of CPR and AED use. So because of that, Maryland passed what's known as Breanna's Law. And beginning in 2015, Maryland now requires all students who graduate from a public high school to be trained in CPR and AED use first. Now, in Howard County specifically, our CPR and AED use training was introduced into the school system in 2012, and it is taught twice, once in middle school health class and then again in high school. This is a skill that I hope you never have to use, but it is something you should try to, refresh every year or at least every other year. 39 states currently have a very similar law requiring this training before high school graduation. Every minute that passes without CPR decreases a victim's chance of survival by 10%. We typically don't think that such a short amount of time, 60 seconds, could really have an impact on anything. However, with CPR, every second counts, so your actions really could be the reason that someone survives or not. Here I have a graph that is showing you the likelihood of survival based on how long it's been from the time cardiac arrest occurred to when compressions are first started. If CPR is initiated within the first 3 minutes, that individual has over a 60% chance of survival. Now, that is a pretty good percentage for something as serious as your heart stopping. Average response time here in Howard County is 6 to 8 minutes. We move down our graph to 6 to 9 minutes, even our 9+ minute category, we are at just under a 20% chance of survival. So really recognize how important your actions are. You really can be the difference with somebody surviving or not. The best chance for survival is immediate CPR. Here we can see our chain of survival. First, somebody has to recognize something's wrong and they call for help, call 911. And that's kind of our reaction to initiate this chain. Next, we want to start hands-only CPR. The earlier that happens to the time of cardiac arrest, the better. Our third link is going to be utilizing an AED if you have one available to you. If you do have access to one, it's always best to use it. And finally, that last link is going to be the arrival of EMS personnel to facilitate a higher level of care and transport to the hospital. So you can see that 3 out of these 4 steps are something that you as an immediate responder would be completing. So again, really recognize how important your actions are, how much of an impact you have on this process. CPR is a partnership with the community. In order for CPR to be as effective as possible, we need members of our community to utilize it. We like to use the phrase, you start CPR, we'll finish. Now that we have an understanding of what sudden cardiac arrest is and how to identify it, we are going to go over our steps to performing hands-only CPR. Now up on our screen, we have 7 steps. That can be a lot to remember, so I break it down into the 3 C's of CPR. Makes it a little bit easier to remember. Our first C stands for check. We have to figure out if anything's even wrong with the person. First, we want to try our best to get the patient on a hard, flat surface. If, for example, somebody was lying on a mattress, when I go to perform compressions on them, they're not as effective. And that's because I am pushing their body down into the mattress. I'm not actually compressing their chest. Now, with that being said, you do have to do the best you can in whatever situation you find yourself in. Going back to lying on a mattress, if you cannot physically move the person down on the ground, that is okay. Leave them where they are and still start compressions. We then need to check for responsiveness. We use a tap, shout, tap sequence to do that. So we're going to tap the person's shoulders, ask, are you okay? And then tap their shoulders again. Now here we are looking for any kind of response. It does not have to be verbal. So maybe you tap their shoulders, they open their eyes, they look at you for a few seconds, and then they go back unconscious. That is considered a response. That's a good sign that their heart is working. So that would indicate you don't need to start CPR. You should probably still call 911 in that case. There's probably some other type of medical emergency happening. But since you were able to receive a response, you know their heart is functioning. If I receive no type of response from them, my next step is to check for breathing. To do that, I just look at their chest for 5 to 10 seconds, and I'm looking for any signs of breathing. If the individual is breathing, I would expect to see the chest rising and lowering in a pretty rhythmic pattern. You can determine that the person has stopped breathing if you either see no movement in their chest or you hear that agonal breathing like we discussed earlier. And that's the gurgling, snoring type sound. Now that I've checked them, I've figured out that they're unconscious, they're not breathing. My next C stands for call. We want to call 911. Now you can either do this yourself or you can task it to another person. This is also the point in time you want somebody to go find the AED and bring it back to you. If you are by yourself, there's nobody else around, you can choose at this point to leave and go get the AED. However, you only want to do that if you can get the machine and back to the victim within 1 minute. So more often than not, you're not going to be able to leave and go find the AED in that short amount of time. Really, the only reason you should decide to do that is if the AED is close by and you know exactly where it is. If you have a feel, like if you know there's an AED close, but you don't know exactly where it is, if you're by yourself, don't waste time trying to find it. At that point, it's going to be better for you to stay with the individual and start compressions. And then our final C stands for compress. When we are performing a compression, we're going to press down into the chest about 2 inches, and we're going to do that anywhere from 100 to 120 times every minute. In between each compression, it is important that you allow the chest to completely rise back up to normal position. Now here we can see our hand placement. So in this first picture, we're taking the heel of one hand and placing that in the center of the person's chest. Our other hand goes on top, and if we're able to, we want to interlock our fingers. For my entire body position, you're typically kneeling on the ground next to the person. So you want to bring your shoulders over top of your hands to create this straight line down. When you do a compression, your arms remain straight the whole time and you're bending from your waist here. By doing that, you're going to utilize your entire upper body. So you're going to be stronger because you're using more muscles. And two, you're going to be able to go for a longer period of time before you get very fatigued. Compressions is hard work. It is strenuous activity. So try to make it as easy on yourself as you can by utilizing your whole upper body. Now here we have a demonstration for you to watch. There is no sound that comes across, so I'll just describe what we are seeing. So right now, he's already done his tap, shout, tap. He's actually checking for breathing right here. He received no signs of breathing. He's asked somebody else to call 911, and he's going to begin compressions. So the heel of one hand, center of the chest. He brought his other hands on top, interlocked his fingers, and now he's beginning to do those compressions. So he's getting about that 2 inches down into the chest. He's going at a rate between 100 and 120 every minute. You can see his arms are staying straight the whole time, and he's bending at his waist. In between each compression, he is allowing the chest to come back up to normal position before he goes back in for his next compression. So switching gears just a little bit, we talk about an app called Pulse Point Respond. And this app is going to notify individuals when somebody is in need of CPR nearby. Now this is connected to our dispatch center. So somebody would have to call 911 and notify us of the emergency. And then if you're within a 1/4 mile radius of the person in need of help, you're going to get a notification through this app. And that gives you the opportunity to go over to the person and begin CPR until EMS can arrive. Now, the app is only going to notify you if the person who needs help is in a public setting and you're within a 1/4 mile radius of that person. So it's never going to send you to somebody's private home or a nursing facility, assisted living facility, something like that. So we look at an example. Let's say you're out shopping, you finished up, you're outside loading your things into your car, and somebody inside the store has gone into cardiac arrest. Chances are you would have no idea that's happening, even though you're pretty close to them. However, once somebody inside has called 911 and notified dispatch, you would get a notification, and that's going to show you where you are. That's this blue dot down here, where the closest AED is, if one is available. And then the yellow heart over here is where the person is in need of help. So you could decide to run inside, you grab the AED as you're going to the person who needs the CPR. In Howard County, there have been several times when somebody was notified through the app and they did decide to go over and begin CPR. In the state of Maryland, there are currently 3 counties that use this app. They include Howard County, Anne Arundel County, and PG County. Another feature that may be helpful for you in this app is our CPR how-to section. So over here, it's actually located down on the bottom. This is how you get to it. So your notification. You have your steps to performing compressions. And then in the center here, you have a hear compression rate. If I were to click that button, it's essentially a metronome. So you're going to be able to hear the beat to the correct tempo for CPR. So that can help you stay on beat if you have issues with that rate. And finally, our last section for our class today we cover AEDs, or automated external defibrillators. Now, this is a machine that you use with CPR. It does not replace CPR. So an AED delivers a shock to the person's heart, giving it a chance to reboot. Now, a few things about these machines: they are fail-safe, so you cannot accidentally shock someone. They are very safe to use. There are two pathways that it can take you down. So the first pathway, it can say shock advised, and we will discuss this pathway thoroughly in the next few slides. The other option is it can say no shock advised, continue CPR. If it tells you that no shock is needed, that does not mean the person is not in cardiac arrest. It just means that a shock is not going to help them at all. And that kind of relates back to how there's multiple causes of cardiac arrest. Not every cause can be helped with a shock. Now, regardless of which pathway the AED takes you down, you always end up going back to compressions. You can find these in a lot of public places now. In all of our county or Howard County buildings, we have at least one, if not more. A good rule of thumb is if there's a gym in the building, the AED will either be inside the gym itself or just outside in the hallways. And then many of our county police cars carry one as well. So very well might be an officer who arrives on scene first. If that's the case, you can work together with them until EMS arrives. Now, a word of note about the AEDs in Howard County government buildings. So this wall mount unit is what the machines are kept on. Inside that unit, in addition to the AED, you are also going to find a stop to bleed kit and a Narcan kit. So in Howard County, it's a good idea to just always check them. You might find the other supplies for a different kind of emergency. Before we can use the AED, there are a few situations we have to be aware of, as it could affect how we use the machine. So first, we have an individual with a lot of hair on their chest. In order for the AED to be as effective as possible, we need the AED pads to have a good, clean connection with the individual's skin. So if there's a lot of hair present, that is going to affect that connection. So we are going to want to remove it. There are two ways we can do that. Oftentimes you will find a razor in the AED kit. If that's the case, just do a quick dry shave, focusing on just the two areas where the pads go. The other option, if you don't have access to a razor, first make sure you have multiple sets of AED pads. If you do, you're going to take one set, open it up, place them on the person's chest, really rub it on, make sure it's nice and connected with the hair specifically, and then you're going to use those pads to wax the person. Once you've done that, you're going to open up a second set of pads to actually place on the person's chest and connect to the machine. Next, we have the presence of water. Now, this is rare, but it would be somebody has gone into cardiac arrest and they're lying in a really large puddle of water. If you can walk in it and it begins to cover your feet, that is too much water to safely use the machine in. That's because you have the potential, if you were to deliver a shock, that shock goes from the injured individual through the water and to your body if you're standing in it. And that could be very hazardous to yourself. A good rule of thumb for determining if there's too much water or not, if you're asking yourself, is this too much water? Always err on the side of caution and assume it is too much. It's always better to be a little more cautious than to take that risk when you're unsure. Now, there are two ways we handle this presence of water. Number one, just don't use the AED machine at all. Just stick with compressions. The second option, if you're able to, you want to move the person out of the water to a dry area. Do your best to dry their chest off, and then you can go ahead and proceed with the AED. Now, in terms of inclement weather, so raining or snowing, it's still safe to use these machines, but again, just try to dry the chest off as best you can. The next situation is going to be the presence of a pacemaker or implanted device. Now, typically when somebody has one of these devices, it will be pretty noticeable. You can see in this first picture here, there's an unusual bulge under the skin. You can tell that something is there. It's not normal. So you can usually identify these fairly easily. Oftentimes, these will be located in the upper corners of the chest. We are only going to be concerned with the right side. That is where one of our AED pads goes. And you can still use the machine. You're just going to alter where you place the pad. So instead of it being in the upper right corner of the chest, you might have to move it a little bit closer to the center or down below the device. You just want to avoid placing the pad over top of it. And finally, we have the presence of medicine patches. Medicine patches do come in a lot of different shapes, sizes, and colors. So it's not always going to be this standard white circle that we see pictured here. Most of the time, people just want to remove the patch if it's in the way. That is not what we want you to do. Instead, you're going to leave it alone and treat it the same way an implanted device. So move the AED pad either next to it or down below it, but not over top of it. Now, the awesome thing about these machines is they are voice prompted. So you just have to turn it on, and then it's going to tell you step by step exactly what to do. So you'll just follow along with it. Now, with the AED, you are going to have to remove clothing off the person's chest. So if you're only doing compressions, you can do that over top of clothing. It's not until this AED is brought into the picture where you now have to get rid of that clothing. So if you can at least get it above shoulders, that is high enough. For women, that does include undergarments, so you do have to remove their bras. The other thing I want to just point out is the AED pads. You are going to have to plug them into the machine. So the pads come in a pack, and they will have these wires connected to it. It is important that you place the pads on the person's chest before you plug them into the machine. So when you plug the pads in to the AED, you are telling that machine everything is set up. You can go ahead and analyze the heart. If I plug the pads in and I'm still holding them, there is the potential that the machine will start to pick up information from my body, and that's exactly what we don't want. We don't want it analyzing my heart. We want it analyzing the person who's gone into cardiac arrest. So quickly, I'm just going to run through what the voice prompts are. So when you get the AED, either you open the lid and it automatically turns on, or there's an on button right on the front here. Once you turn it on, the first thing you're going to hear is to call 911. Next, it's going to say to bare the person's chest. That means remove all clothing. There's then a pretty long pause that allows you time to actually get rid of that clothing. It's then going to instruct you to pull the red handle to open up a set of pads. So these pads come in their own individual packages. Each package does have a red handle. So you pull one handle out, you open the pads, you'll take them out. The next instruction it gives you is to place the pads on the person's chest, exactly like shown in the pictures. So we can see here that the yellow pad has a picture of it being placed in the upper right corner of the person's chest. And then our red pad, that is getting placed on the lower left side of the chest. Once I've put that on, I can then plug them into the machine. The AED is then going to say all clear, analyzing the heart. So your hands go up, Nobody should be touching the person during this period. After a few seconds, it's either going to say, no shock advised, continue CPR, in which point you go right back to compressions, or it is going to say, shock advised, preparing to shock. After a few seconds, the machine will start to siren at you, and then this shock button will start to flash at you. Once that is flashing, you want to do an all clear. Make sure nobody's touching the person. You can go ahead and press that button. A shock will be delivered. And then the machine tells you continue CPR or continue care. Regardless of which pathway you went down, once the machine says continue CPR, you will perform compressions for 2 minutes, and then you'll hear the machine cycle through again. So it'll start again with the all clear analyzing the heart. And it's just going to continue that until it's turned off by EMS personnel or the battery dies. If the battery does run out, don't worry about removing the pads. Just move the AED so it's not in your way and stick with doing compressions. So here we have an example of our AED pads. On this second picture, we have 2 separate pads. So this is what we just talked about and what was on the slide before. This second one over here, this is actually all one pad. These are kind of starting to become more popular. How this works is this part right here should go in the center of the person's chest. So your hands will be over top of this red line when you're doing compressions. It's then one piece, so you'll just flap it out and then you can plug it in. All right, that is the end of our presentation. I thank you all for listening. I hope you found it helpful. If you do have any questions, please feel free to reach out to us. You can email us at outreach@hcdfrs.org or go ahead and give us a call at 410-313-2016. Have a good day.